Assalamu alaikum. Good afternoon. I am Dr. Anandi. I am working as a specialist neurologist in Medcare Hospital, Sharjah. So, as of neurologist, I am one among the few women neurologists in UAE. I am specialized in treating headache, epilepsy, stroke, Parkinson's disease, dementia, and multiple sclerosis. Today, we will be just seeing some of the common neurological disorders which is affecting women especially. Even though we speak there is no gender difference between male and female, there are some diseases which are very common with men and some are very common with women. We know like women face like lot of hormonal changes, especially during menstrual periods, during pregnancies, and even the postpartum stages, and during perimenopausal and menopausal time also. So, because of these hormonal changes also, women are more frequently getting some neurological problems. The other part in women and neurology is like because of these changes, when we are going to try some medication for some disorders, then we have to be more careful while selecting the medication. We have to know about their menstrual history, we have to know whether the lady is pregnant or not, or in menopausal stage, like those things, then only we can start the medications. So commonly when we see, women are more commonly affected with headache, especially migraine headaches, which is more frequent, or you can say double when compared to men, the women are getting affected. Other than that, the tension type headaches are also there. So in choosing the treatment for migraine, there is like different medications which can suit for some females and not for others. So we need to decide about those things also. And epilepsy, there is not much difference between the frequency of epilepsy in men and women. But when you choose the medication, yes, there is a difference, because some of the medication that they can affect their hormonal changes, and so we need to choose. Suppose if the patient is willing to get pregnant or if she is planning for pregnancy, we have to avoid certain medications. So in the reproductive group, we avoid certain medications with the anti-epileptic medications. So that we have to take care of that one also. And when we come to multiple sclerosis, even multiple sclerosis is more common with women when compared to men. Even there is no risk factor or nothing, because multiple sclerosis as of now, they have not identified a specific reason other than vitamin D deficiency and smoking, but still women tend to get multiple sclerosis very frequently. So these are the changes, or these are the things we are going to discuss today. And now I will invite Ms. Agadia, our marketing department, to ask or to clarify some of these points which I have highlighted now, and the questions that you are going to ask. Yes, we are ready here to answer that.
Thank you very much, doctor.
Yes, welcome, Agadia.
Yes, you just talked about the neurological problems, and as you mentioned, there is no difference between men and women, of course, in science, but can be like we're living now in a very stressful time, as you can see. So, can stress cause the neurological problems?
Yes, dear. Actually, stress, what I say is, stress as such can increase any neurological disorder, even though it is not going to directly cause any neurological problem. Like it can increase the problems which is already existing. For example, I spoke about migraine, and stress is one of the trigger for migraine. So the stress as such, it develops a stress induced headache which can convert into a migraine headaches also. Yes, definitely there is. And as of everybody will accept, women are more tensed than men, I think so.
I agree. That's beautiful. Thank you very much for your answer. Another question, if we're talking about the migraine, right, how we can figure out that, okay, this is exactly migraine, because the headaches and different situations happen.
See, actually headache, we call them as like primary headaches and secondary headaches.
Okay.
So the primary headaches are the headaches which come without reasons. Okay. And secondary headaches are like with reason. Okay. With reason, like you may be knowing about tumor, you may be knowing some vascular malformations, or maybe infections, even stroke, they can cause headaches. These headaches are called secondary headaches. But migraine is one of the primary headaches, and it is a very common headache also. So this migraine, as you are asking, yes, like only with the headache you cannot diagnose, okay, this is migraine or this is that, this is this. So we need to ask so many questions to that patient regarding what is the type of the headache, what is the nature, the duration of the headache, and what are the associated factors, like are you having any vomiting or any photophobia or visual disturbances, like those questions. So migraine, see, literally it means hemicranium, that is usually it affects one sided, but it can be on both sided also, and usually it is associated with vomiting and dizziness, and as I said, the visual disturbances also. And this headache usually lasts for 6 hours to 72 hours. So these are the factors we take into account, and this type of headache should be intermittent, and it should be like at least more than 3 months to diagnose a migraine. So if the patient is coming for the first time with this symptom, we can suspect a migraine, but you cannot put it is a definitive migraine.
Okay, doctor. So what you're trying now to say that if we follow up with all those signs, so we should call to doctor, or we have to just wait?
Yeah.
What is
No,
this
it is like because the migraine headache will be very severe, so they have to come to the hospital at least to take the painkiller. But after that, there are so many other treatment options are available that we don't start immediately. We observe them for further frequency of migraine and other things, and then only we start the preventive medications. So there are some medications which we use for preventing these headaches, and some medication for treating this headache. So for treatment purpose, they have to come immediately.
Okay, okay, that's beautiful. Here we have a question from our Facebook viewers regarding the, just a moment, I will clarify. So, what earlier we were talking about the epilepsy as well can cause by. So, can epilepsy be cured?
Yes, dear. Actually, epilepsy also there are like lot of varieties of epilepsies are there.
Okay.
Not all the epilepsies can be cured. There are some epilepsies which can be completely cured. There are some epilepsy which can be controlled by medications, and there are some other epilepsy which can be controlled by surgical measures, and there are some epilepsies which we cannot treat also, like or you cannot control, but they have to take medicines for lifelong. So it varies with the type of epilepsy and what is the reason behind the epilepsy, and even from patient to patient.
Okay, doctor, regarding the epilepsy, how we will understand that, okay, at the moment we have that epilepsy situation, or this is exactly the epilepsy?
See, epilepsy, like everybody, like every lay person, they must be knowing from watching movies and
Okay.
these
I understand.
serials. They show like a generalized epilepsy,
Okay.
where the patient will throw like both, they will throw both the hands and legs, and they will fall down with loss of consciousness. And this we call it as a generalized epilepsy.
Okay.
This is actually one of the type only. There are other so many varieties of epilepsy which can be like, and it is also specific for the age group, like some epilepsies are common in children, and some are common in adults, and some in old age, like that. And it can present in variety of presentation. They may just fall down, or they may be just standing without any clues or what is happening around, like those things, or they can start only in one limb, like those things. So usually in epilepsy, what we do is we rely on the history from the patient and also from the eyewitness, that is whoever is with them. Either it can be a parent, or it can be a teachers, or it can be friends. So we have to rely on their history also. So once we have to rely on that history and the patient's history, and then we will conclude, okay, it could be a possible epilepsy.
Okay.
Then we do some test to confirm it. And one of the tests is like electroencephalogram. So normally patients ask me like, what is EEG? So I always tell it is as simple as like ECG, because everybody knows ECG. We monitor the rhythm of the heart.
Yes.
Same like that in EEG, we are monitoring the rhythm of the brain.
Okay.
Only thing is we are monitoring for little longer duration, and then we give some stimulus also to induce the brain if there is any epileptic potentials and anything, and then we start treatment after the EEG is confirming the epilepsy also.
Okay, doctor, beautiful. So I have a question now. In
Yes.
case if we have at home, outside, any situation that there is a epileptic
Person.
situation, should we treat to do some treatment immediately? Wait for doctor? What should be our action at that
Okay.
moment?
See, as such, like epilepsy, that the duration of the epilepsy is less than 5 minutes.
Okay.
Normally for every patient. So even before you could reach your phone or you could call for the help, he will recover also, or he will go for a deep sleep also. So the only thing what you have to do is, like, just try to avoid hurt, like to get hurt that patient. Like for example, if he is now sitting here and developing an epilepsy, he may fall down and get hurt with this chair or even in the floor, like those things.
Yes,
So you
true.
need to remove the obstacles near the patient. That is the first thing you need to do, like a table or wherever possible way he can hurt, that you need to remove. Second thing is, like, make him lie down in the floor, and also like make his head turn towards one side so that he is not swallowing his own saliva. That is the maximum thing you can do.
Okay.
Don't try to put anything inside his mouth, and don't try to hold his hand or resist his hands when the hands are convulsing. So that is the most thing, because like what happens in many people, they just try to put their finger inside their mouth, inside the patient's mouth, or even the spoon or whatever they get, they try to put. But don't do that. Just put their head on one side, that's fine, and within 5 minutes patient will improve. So he will get up or he will go for a sleep. So after that you can bring them to the hospital. But if suppose the epilepsy can be for longer duration,
Okay.
like if it is recurring again, or if it is not getting controlled within 5 minutes, it is an emergency. We have to call the ambulance and we have to arrive at the hospital.
Okay. So should we wait until he will get better, or like the patient
That's
will
what,
feel
that is
better,
5
or we
minutes.
have to just go?
5 minutes,
Beautiful.
less than 5 minutes you can say.
Okay, that's beautiful. So here we have a question in our Instagram page. Okay, so the question is that in neurological practice there is a different type of disease and dementia and things. So there is called what can cause dementia.
Dementia.
So can you give us a bit brief about dementia?
See, dementia is like reduced cognitive ability of a
Okay.
patient.
Okay.
So we know, like for example, when you take us as an example, we know what is happening around our surroundings or what is happening inside our body, and we tend to remember the things, like birthdays or whatever things that has happened long before or years before. So these are all collectively called as a cognitive ability of a person.
Okay.
So when this cognitive ability is deteriorating, we call that as dementia. So the earliest sign will be the patient tend to forget things. So they will not be able to remember, like for example, where they kept the keys, where they kept their dress, or where they kept their file, or even sometimes they may forget to collect change from the groceries. So this will be like a memory disturbance is the earliest signs of dementia. Even dementia also, it's like they have like so many types, and most of the common dementia they occur in the old age,
Okay.
above 60, like that. That is the main what you can say, like the Alzheimer's dementia
Okay.
is one of the dementia which is very common, and it happens above the age of 60. Only very few people, when they have like some genetic alterations or something else, then they can get this dementia at an earlier stage. So why I want to specify this point is, I do see patients who are coming to me with subtle memory disturbances and difficulty in concentrations, maybe at the age of 30s and 40s, like that, and they are very afraid that am I getting an Alzheimer or am I getting a dementia, like those things. But for that, actually what we do is, like we have a scale called mini mental scale examination, which examines the basic cognitive functions, and we put a score, and that score will be normal for most of the patient. And we do like vitamin B12 and thyroid, which can cause these disturbances.
Okay.
Even if that is normal, nowadays like most of the youngsters, they are busy in the schedule, they are always stressful, and they are not sleeping properly, and even that could cause this memory disturbances and difficulty in concentration. So your previous question, like, yes, stress, does it affect? Yes, it affects in this aspect also.
Okay, it's beautiful. I think our viewers will be glad to as well hear that there's just a moment. There's a neurological problems, right? So from which age until which age, example, like till which age we have to go and check like how often we have to go and check with a neurological doctor ourselves, and from which age we have to start it.
No, it is like not like how often we have to go or we have
Okay.
not to go, because this is not a general health checkups. Only if you have any neurological problem, you have to meet. That is the first thing.
Okay.
And neurological disease can affect at any age in the sense from birth to death. So any age it can affect. And nowadays there are pediatric neurologists are available who will see patients from birth to 12 years, and we are adult neurologists, we see from 12 years to like elderly patients also. So at any age, if you suspect like any patient is having headaches, or if you suspect like anything like epilepsy or back pains or neck pains or some like this memory disturbances and other thing as I was telling, or if you feel any numbness or if you feel weakness, you can meet a neurologist.
Okay.
And regardless of their age.
Okay, doctor, I have a question. In case if you know that sometimes we have our home treatment, right? We're having any medication. So, is there any first aid, let's say, medication that we have to use for certain situation if we're seeing that we're stressful or we're in kind of situation?
As such, there is no like immediate rescue in home for any of the neurological problems as such. But there are some triggers that we commonly speak with epilepsy and migraine. So that one we covered actually in the first, the migraine and epilepsy.
Sure.
There are some triggers which can bring the migraine and triggers which can bring the epilepsy. So we have to avoid those triggers.
Okay.
For example, in a migraine patient, like the sleep is the main trigger. When I say sleep, it is either sleep deprivation or sleep excess. Both can cause this migraine attack. So ideally an adult should sleep like 6 to 8 hours, and I always stress that point, this 6 to 8 hours should be at night, like not like going late to the bed and then waking up late, not like that. So if you are sleeping less than 5 hours, or if you are sleeping like more than 9 to 10 hours, both can trigger a migraine. So this is the first trigger. Okay. So try to get sleep, that is the first thing. And the second trigger will be like eating food. Like we have like a common practice, that is I am seeing here, like we skip meals, either breakfast or lunch or whatever it is. We find some time and then take the food. We don't eat on time, or we don't eat when we are hungry also. So eat food on time, that is the second thing, with adequate water like 2 to 2.5 liters per day.
Okay.
So these are also the triggers for migraine. And there are certain food which can cause like a migraine, like cheese and chocolates and cakes and even excess coffee, like those things also can cause that. And stress, as I told you earlier, is one of the trigger. So this is like what we can do to avoid migraine. And when I say about epilepsy,
Okay.
so there are triggers in epilepsy also.
Beautiful.
And here also sleep comes most important. If you are sleep deprived, that can precipitate an epilepsy. And the second thing is the lights, the blue light or the LED
Yes.
lights which are emitted from the mobile or viewing long time in the screen like computer screen or video games, they can also trigger epilepsy.
Yes.
We say this is a photosensitive epilepsy also.
Okay.
So I
there's
always advise, even nowadays we are just like that, giving the kids the mobile and they are playing in the mobile for a long time, like continuously for 1 hour, 2 hours. That should be definitely avoided, because that can trigger an epilepsy attack also.
Okay, so
And especially like the teenagers, sorry to interrupt.
no worries.
In the teenagers, when you see in the night time, they go to the bed, switch off every light and see with the mobile for continuously 1 hour. Even that can affect the brain and eyes also. So try to avoid those things. So this is like common triggers for the epilepsy also.
Great. I'm sitting with my phone as well. I think everyone watching us too, sitting through the phone. It's fine. So another question I have, as we're talking about neurological problems and things, there is any difference how we can say that, okay, this is dementia and this is Alzheimer example, or there's the difference, like just to
No,
understand.
it is not like difference, I can say. Dementia is a general term.
Okay.
Like for example, now we discussed about headache.
Okay.
Headache is a general term.
Okay.
It can be due to anything like migraine, tension, or as I told you, tumor, vascular malformation, like that. But it's a general term. Like that, dementia is a general term.
Okay.
Among the dementia, we say there is Alzheimer's dementia,
Okay,
there is frontotemporal dementia, there is vascular dementia. Like there are treatable dementias are there. So like those things. So Alzheimer is one of the dementia.
Okay.
So Alzheimer's as such, there is no direct test to tell Alzheimer's dementia. It's more of like the clinical signs and symptoms that patient is presenting, and some investigations we need to do to diagnose an Alzheimer's dementia.
Okay, it's beautiful. So in case if we're saying that we're in stressful situation, we have certain things, when it's mandatory to go and check yourself with doctor, right?
It is better, always better, because they can help you at least like how to overcome the stress and
It's
other
so true.
things.
It's so true. Earlier we were talking about like female and male, as the topic is going now.
Yeah.
It can be as well cause all the neurological problems. Sorry, I'll just leave my phone. The home environment situation you said about the lights, about the phone usage, about certain can be like our technology, like microwave and all those things as will be affected, because as far as
no, not like that actually, because there are still researchers are going on that microwaved cooked food can cause damage to here
this is
and
we're
there.
hearing a lot.
Yeah, but still now it is not proved like yes, this is causing that or not, like those things. Only thing why women are more getting stressed is because most of the women, okay, some are coming out for work and other thing, but most of them are sitting in home, and once they cook food and the kids will go to the school, husband will go to the office, and they will be sitting all alone in the home and thinking too much. Yeah, that's the main thing. It's overthinking, and that is the reason they are more stressed also. And as I told about the hormonal changes, which can be related to the menstrual period, yes, even that hormonal change can be the reason for the stress that we develop just before the menstrual period. You know about the premenstrual tension, like every woman used to have. That's due to the hormonal change and not due to the external influences.
Okay, that's beautiful. So I just want to invite all our viewers, if you have any questions, so you can ask doctor right now. And yeah, here we have some other questions. I need to just choose one of them and see. Okay, just a moment. Okay, there is one of our viewers asking about stroke. Okay, so the question is, are there a warning sign days before a stroke?
Yes, dear. Like a stroke also, they cause like some warning signs. And here also, like not all strokes, few strokes. Like when few strokes which is formed by the clot, they can produce only. It's not like a must. They can produce a warning sign. Like they will have like a temporary weakness or temporary numbness or even dizziness or some slurring of the speech, like those things as a warning sign, and they recover also. So even if that signs are there, yes, you need to meet a doctor. Even though you should not just like that leave it, okay, now I have improved, it's okay, like those things, because it is like a warning bell for a future big stroke also.
Okay, beautiful, doctors. Now I just want to mention that in case we talk, I think we catch all main topics so
yes,
far.
most of the topics.
And we say that like we're talking about the women problems now. So what you can suggest now for our women, for our viewers, about just to prevent or cure this problem, just to finish
that actually we discussed earlier. That is the first, when I was discussing about migraine. See, this is not only with the women, it is for the men, women, children, for everyone. Like take a proper sleep, 6 to 8 hours, and take food adequately or on time, and drink adequate water, and don't take too much stress. Like as everybody says, problems can come and go.
So true.
Yeah.
Yes.
It will definitely go. Don't keep on sticking with that.
Okay. I think it was beautiful conversation with doctor. And yes, just a moment. so far we don't have much. Okay, Dr. Anandi, I want to really appreciate your time for today.
Thank you,
And I
dear.
want to invite all our viewers, if you have anything, and I hope first you don't have anything health problems, but you can always book an appointment with our medical center, Medcare, and book your appointment with us. And Doctor?
Yes, thank you, viewers, and I really thank the Medcare Hospital also. If you have any queries, feel free to comment in the box below, or you can visit me also in the Medcare Hospital. And thank you. Shukran.
Beautiful. Thank you very much, everyone.